Sleep. It's something we all need. Yet for millions of people around the world, it's anything but restful. Sleep apnea, a condition that disrupts breathing during sleep and affects nearly 1 billion people globally. But did you know there are different types of sleep apnea? Today, we're diving deep into the world of obstructive sleep apnea and central sleep apnea. What are they? How do they differ? And most importantly, how can they be treated? Stick around, because by the end of this video, you'll have a clear understanding of these two conditions and what you can do about them. Let's start with the basics. Sleep apnea is a sleep disorder characterized by repeated interruptions in breathing during sleep. These interruptions, called apneas, can last for a few seconds to a minute and can occur dozens or even hundreds of times per night. The result? Poor sleep quality, daytime fatigue, and a host of other health issues. But not all sleep apneas are the same. The two main types are obstructive sleep apnea and central sleep apnea. Let's break them down. Sleep apnea is broadly categorized into three types: obstructive sleep apnea, OSA, central sleep apnea, CSA, and complex sleep apnea syndrome, which is a combination of OSA and CSA. Today we'll focus on OSA and CSA, as they are the most common and distinct forms. First up, obstructive sleep apnea, or OSA. This is the most common form of sleep apnea, affecting approximately 80 to 90% of sleep apnea patients. OSA occurs when the muscles in the throat relax too much during sleep, causing the airway to collapse or become blocked. When this happens, airflow is reduced or completely cut off, leading to a drop in oxygen levels in the blood. The brain then senses this lack of oxygen and briefly wakes you up to reopen the airway. These awakenings are so brief that most people don't even remember them, but they can happen dozens of times per hour, severely disrupting sleep. Common symptoms of OSA include loud snoring, gasping or choking during sleep, morning headaches, and excessive daytime sleepiness. Risk factors for OSA include obesity, a thick neck circumference, smoking, alcohol use, and family history. If left untreated, OSA can lead to serious health complications like high blood pressure, heart disease, stroke, and even diabetes. One of the most dangerous aspects of OSA is its impact on cardiovascular health. The repeated drops in oxygen levels and the stress of frequent awakenings can strain the heart and blood vessels, increasing the risk of hypertension, arrhythmias, and even heart failure. Additionally, the chronic fatigue caused by OSA can impair cognitive function, leading to memory problems, difficulty concentrating, and an increased risk of accidents. Link in the description for our top OSA treatment options. Now let's talk about central sleep apnea, or CSA. Unlike OSA, which is caused by a physical blockage of the airway, CSA is a neurological issue. In central sleep apnea, the brain fails to send the proper signals to the muscles that control breathing. Essentially, the brain forgets to tell the body to breathe. This results in periods of no breathing effort at all, followed by sudden awakenings as the body struggles to resume normal breathing. CSA is less common than OSA, accounting for about 10 to 20% of sleep apnea cases. It's often associated with other medical conditions, such as heart failure, stroke, or the use of certain medications like opioids. Symptoms of CSA can include shortness of breath, difficulty staying asleep, and frequent awakenings during the night. Unlike OSA, snoring is less common in CSA, which can make it harder to diagnose. Diagnosing both types of sleep apnea usually involves a sleep study, known as polysomnography. During this test, various body functions are monitored, including brain activity, eye movement, heart rate, and breathing patterns. This helps doctors determine whether the apnea is obstructive, central, or a combination of both. So, what are the key differences between obstructive sleep apnea and central sleep apnea? Let's break it down. OSA is caused by a physical blockage of the airway, while CSA is caused by a failure of the brain to send proper breathing signals. OSA is more common and often associated with obesity and lifestyle factors, whereas CSA is often linked to underlying medical conditions like heart failure or neurological issues. Symptoms of OSA typically include loud snoring and gasping for air, while CSA is more likely to cause shortness of breath and frequent awakenings without the snoring. Now that we understand the differences between OSA and CSA, let's talk about treatment options. For obstructive sleep apnea, the most common treatment is continuous positive airway pressure, or CPAP therapy. A CPAP machine delivers a steady stream of air through a mask, keeping the airway open during sleep. Other treatments for OSA include lifestyle changes like weight loss, avoiding alcohol, and sleeping on your side. In some cases, surgery may be recommended to remove excess tissue from the throat or to reposition the jaw. Link in the description for our recommended OSA treatment options. For central sleep apnea, treatment often focuses on addressing the underlying medical condition. In some cases, CPAP or BiPAP machines may be used to assist with breathing. Another option is adaptive servo ventilation, or ASV, which adjusts airflow based on the patient's breathing patterns. In severe cases, medications that stimulate breathing may be prescribed. Living with sleep apnea can be challenging, but with the right treatment, it's possible to regain control of your sleep and your life. If you suspect you have sleep apnea, don't ignore the symptoms. Untreated sleep apnea can have serious consequences for your health and well-being. Talk to your doctor, get a sleep study, and explore your treatment options. Remember, a good night's sleep isn't just a luxury, it's a necessity. Thanks for watching. If you found this video helpful, don't forget to give it a thumbs up and share it with someone who might benefit from it. Sleep apnea is a serious condition, but with the right knowledge and treatment, you can breathe easier and sleep better. Until next time, take care of yourself and prioritize your sleep. Sweet dreams.